Good afternoon. I'd like to welcome everybody to this Pitt County Department of Social Services Board meeting on this Tuesday, July 12th, 2022. And so calling the meeting to order, we're going to start by observing a moment of silent prayer or silent meditation. Thank you. Okay, thank you. So, do we have anybody signed up for public comment? Thank you. So on today's agenda, we do have a couple revisions on today's agenda, which are, we actually have three of them, and we'll do these together as one amendment to our agenda. Under items for action, we have two documents that the board needs to take action on. One is the Energy Program Outreach Plan, and the other one is our Links Plan. So those are two items for action. Under items for report, Mr. Dancy is going to give us update on the director's search process. So Mr. Dancy will do that. So three items for our agenda in terms of revisions. One other, that's correct. Thank you, Augustine. So by Mr. Dancy doing that in public meeting, we no longer need our closed session. So we're going to scratch the closed session for today. So any questions about that?
No, Mr. Chairman.
Yes.
Mr. Chairman, I offer the motion that we approve the agenda as amended.
Thank you. Could I have a second on that?
Second.
Thank you. All those in favor say aye.
Aye.
Aye. Thank you. So you all received copies of the previous minutes. Any questions or revisions regarding the minutes? If not, could I have a motion, please?
Second.
All those in favor say aye.
Aye.
Okay. Next on our agenda, this is, we have a swearing in, not a new board member, but a board member entering his second term, and Mr. Jerome Dancy. So I think he's going to take the stage here and be sworn in for his second term. We want to thank him for his service.
Okay. I, Jerome Dancy,
I, Jerome Dancy,
do solemnly swear
do solemnly swear
that I will support and maintain the Constitution of the United States.
that I will support and maintain the Constitution of the United States.
I, Jerome Dancy,
I, Jerome Dancy,
do solemnly swear
do solemnly swear
that I will be faithful and bear true allegiance
that I will be faithful and bear true allegiance
to the state of North Carolina
to the state of North Carolina
and to the constitutional powers
and to the constitutional powers
and authorities which are
and authorities which are
or may be established
or may be established
for the government thereof,
for the government thereof,
and that I will endeavor to support,
and that I will endeavor to support,
maintain, and defend
maintain, and defend
the Constitution of said state,
the Constitution of said state,
not inconsistent with the Constitution of the United States,
not inconsistent with the Constitution of the United States,
to the best of my knowledge and ability.
to the best of my knowledge and ability.
I, Jerome Dancy,
I, Jerome Dancy,
do solemnly swear
do solemnly swear
that I will well and truly execute
that I will well and truly execute
the duties of my office
the duties of my office
as a member of Pitt County Board of Social Services
as a member of Pitt County Board of Social Services
according to the best of my skill
according to the best of my skill
and ability,
and ability,
according to law, so help me God.
according to law, so help me God.
Okay. Get you to sign that one, and we'll get you to do the rest of them later.
Thank you.
Do you think we need to give him an applause?
I think so. Congratulations. Thank you, Jerome. Okay, this is our July meeting, so the next item on our agenda is the election of new board officers.
Mr. Chairman, if I'm in order, I'd like to nominate Ms. Catherine Nelson for chair.
Could I have a second?
Second.
First, are you willing?
Sure.
Okay.
Absolutely.
Second, we have Sheila Bunch, Dr. Bunch is a second. All those in favor say aye.
Aye.
So moved. Okay, so second, we'll need the same action on a vice chair.
I'd like to nominate Mr. Jerome Dancy. for
I
vice
second
chair.
that.
Thank you. Mr. Dancy?
Yes.
Okay. So all those in favor of Mr. Dancy being the vice chair?
Aye.
Say aye.
Aye.
Aye. Okay. So I think that deserves a round of applause, too.
Absolutely.
So traditionally, when I took this chair, I remember.
They got it moved.
Miss Elliott, we did a shuffle. So this is gonna be an easy shuffle. You're gonna move one to the left, Mr. Dancy's gonna move one to the left, and I'm gonna move over there. Yes.
That was your last instruction, wasn't it, as chair?
So did you make the amendments on your agenda? or you-
So,
I didn't get
I
all
won't.
down, but,
Yep, yep.
yeah.
Madam Clerk, could you please switch the names?
Yes. Oh, the seat's warm.
See, that was an easy switch.
Do the shuffle.
I actually thought about that.
I'm impressed.
Thank you, Madam Clerk.
Different view.
One
it is.
closer.
Different angle.
Now we go to items of action.
All righty. So do we want to recognize our new hires and retirees?
Yes.
Yes.
Okay.
Our new hires, is anybody here today?
Mighty Poe looking to me.
We have Tina Brown, Sheldon Sharp, Nancy Ramirez, Ciara Evans, Pamela Jones. We have one retiree, Sharon Jones, who is retiring. We also have Service Milestone Awards and Recognition. 5 years, we have Monica Daniels, Crystal Gauthier, Shanita Gibson, Aisha Jones, Candice Manning, Bridget Morris, Aisha Phillips for 5 years. For 15 years, we have Leonard Collier, Shante Carson, and for 30 years, we have Christine Adams.
Wow.
Those are our honorees and new hires.
I have a question.
Yes.
Dr. Frazier, my question is, were the new hirees aware that we would like to look at them today?
They are in training right now.
They are in training.
Yes.
Oh, that's a good enough excuse. Thank you very much.
So I would suggest we do another round of applause for that.
Absolutely.
We certainly clapping our hand today.
Okay, now we're on the items for report. You want me to turn that to you?
Okay, no,
Or do-
you
or
just
is
energy
Mr. Dancy
outreach.
going to do the, which one do you want to do first?
Items for report. You want to do action for actions or report?
Items for report, that's what we're
Okay.
doing.
Mr. Dancy?
So as we know, we decided to extend the search for the director for 30 days. That search actually ended last Friday. Applications have been sent to Raleigh, and we are now awaiting those applications to come back from Raleigh. Hopefully, I can't promise, but hopefully very soon, maybe by the end of this week.
Okay. Sonia Scott?
So we now have Sonia Scott to talk to us about Child Support Awareness Month.
Good afternoon. August will be Child Support Awareness Month. It's when we bring awareness to the community about the child support program. and we have some events scheduled for the community in August. On Tuesday, August 2nd, we'll have a child support walk that will start at the Human Services Center. That will take place at 9:00 a.m., and we're asking all of you to come and join us for the walk. On Thursday, August 11th, we will do our free DNA testing day again, where we'll provide DNA testing to all existing cases where paternity has not been established. That will be free of charge. That will be from 8 a.m. to 7 p.m. that day. Individuals will have an opportunity to also apply for child support services, as well as we will have staff present all day on that day. And then new for this year, on Wednesday, August 17th, we're going to have a job fair that's specifically catered to the non-custodial parents in the child support program. We partner with NC Works to help us host this event.
Cool.
It will be held at NC Works, and we're still in the process of drafting those plans. So hopefully we'll be able to report some exciting results to you guys when we come back in August about that. And Mr. Dancy, I'm pretty sure we'll be reaching out to ECBC to join us on that day.
Keep looking over here for Mr. Dancy. Where'd he go?
So we appreciate NC Works working with us on that. And then August 20, that is going to be from 8 a.m. to probably at least 4 p.m. We don't have all the specifics for that. We're waiting for NC Works to get back with us, but they have agreed to partner with us on this and help us out with this. But we're going to do it at their location because it's much more convenient for us to get folks registered. And they have the space for employers to be able to set up in different rooms. And then from August 23rd through the 26th is our annual child support conference that will be held at the Harrah's Resort in Cherokee, North Carolina. And we will have approximately 15 staff members that will be able to join us this year. And I am the president of North Carolina Child Support Council for this year, so
Congratulations on
we've
that.
got some
Well,
fun and
that's
exciting
more
things.
hand clapping.
Thanks for
So,
doing that.
and we'll report on those. I'll report on those in September about the success, because I know all the events will be a success.
Thank you. That's
Okay.
very nice.
See, that was August.
So we also have
Yeah.
crisis intervention.
And I do want to report that we do have our total collections for the fiscal year 2021-2022. The child support program collected $15,769,264 for the fiscal year. On to our crisis intervention program. For the fiscal year 2021 and 2022, our total allocations, of course, was $769,000. We issued $755,996.73. Our remaining balance for the year was $13,026. So that's very good compared to previous years. We approved a total of 4,849 households, and we denied 2,529 households.
Good work. Thank you.
Thank you. Okay, Brian Avery, want to come up and talk to us?
I'd like to ask that last date of August 23rd to the 26th. Is that something we expected to go to? Okay.
Good afternoon.
Good afternoon.
I'm reporting on the low-income household water assistance program. As of June 30th, we had assisted 714 households, and the average assistance payment was $352. This program continues to operate, and as of June 30th, there was $140,025 left of what had been allocated for the water assistance program. However, the state is doing a reissuance to continue the program for this fiscal year we're in now, and we do have funds to continue taking applications, and we have continued the program. We will have the update on the allocation for this fiscal year available at your next meeting. I'll be able to report on that amount at that time. And I'll be happy to answer any questions you have about the program.
Any questions?
Yes, are you seeking community partners? for
We
this?
always are for low-income energy assistance for that particular program. And I'll be talking a little bit about that in the plan, that I presented this in your packet. We're always open to community partners to assist with the LEAP program. And the LEAP program will start back again December 1st of this year. But anybody that's interested in assisting as a community partner at any time, contact me and I'll be happy to talk to them about it and making plans ahead before December.
It's good to have the, some partners in the outlining rural areas of Pitt County so that people will not have to spend much gas to get it. That's why that is very important to me, having a rural area.
Yes.
So, when you send out the invitation, I can send it to
Okay.
places.
I'll share it with you, yes.
Thank you very much. Now, this LIHWAP, is that something
That's
new?
the water assistance program.
Water,
that's the water
and that's the
assistance
same
program.
thing.
Right, that's a separate program for water
But
assistance, yes.
you have the opportunity at the same time to do it, correct?
Well, that's ongoing now, that continues. LEAP is just December through March.
Mm-hmm.
But the water assistance program is ongoing at this point.
Okay,
As long as we have funds, we'll continue offering that assistance.
good.
Okay,
So
thank
Brian,
you.
do you want to go ahead and
I will.
talk about
I'm
your
happy,
energy
yes.
action plan?
This is our annual Energy Programs Outreach Plan, and Sonia Scott, who is the Family Support Services Administrator, and I collaborated to update the plan for this fiscal year. Sonia is responsible for the crisis intervention program that she spoke about earlier, and I'm responsible for the low-income energy assistance program, so we collaborated on this. The plan outlines how the programs are operated, how the programs are publicized, outreach that's done to make people aware of the programs, the application portals, how clients can access, and the application portals are by online, by telephone, by mail, or in person. They're the application portals for the SIP and LEAP programs. And at the time the LEAP program begins, prior to beginning December 1st, at that point, we will have commitments on who will be actually offering sites other than DSS to where clients can stop in and make an application if they'd rather apply in person. So I'm happy to answer any questions you have about the plan. It will require your approval before we submit it to the Department of Health and Human Services.
Any questions for Mr. Averett? So do I have a motion to approve the plan?
I will make that motion to approve the Energy Program Outreach Plan. as
And I
presented.
like to, there you go.
Okay. So we have a motion and a second, so if everyone will affirm by saying aye.
Aye.
Thank you.
Thank you, Brad.
Thank you.
And now we have the Links program.
Brenda Dawson.
Brenda Dawson. Thanks.
Good afternoon. Excuse me. We are trying, I think last year I came in and presented the same thing, to send some of our Links youth and our staff to the conference in Florida. This year, we're wanting to do the same thing. We're wanting to send 3 youth this year. Last year, we only sent 2, and 2 of our staff, Ms. Carson, who is our Links coordinator, and Tasha Wilson, who is our 18 to 21 social worker. So we would like to send them. This year's theme is Growing Pains. So, and it's geared towards youth and professionals for 15 and up. One of the youth that we would like to accompany is the co-chair for our Say So program here in North Carolina. And part of the training and the programs that youth will get to go to will help be able to contribute to the programs here in North Carolina. In addition, Ms. Carson and Ms. Wilson, through the training that they can get, they will get up to 16 hours of continuing education credits. North Carolina requires us to have 24. So to be able to get 16 that are very specialized for working with the links and the 18 to 21-year-old, that's a lot and very much needed for our population. So the funding is going to be done through links. A lot of it will be reimbursable. We won't be able to do it all until Miss Angela does all the math at the end of everything. So yes, we would like for you to approve 3 of our youth and 2 of our social workers going to Orlando August the 30th through September 2nd.
Move to approve.
I second.
Okay, so we have a second. Do we have, everyone say aye to affirm?
Aye.
Aye.
Thank you. Okay.
And it'd be-
Thank
I hope
you.
they have a great trip, and it'd be great to hear about it. on the
I'll
budget.
see if either Miss Shantae or Miss Tasha can come and present to y'all in September after they return.
Great.
Okay.
We do have money in the budget, don't we?
Angela? Angela?
Yes, we do have
Absolutely.
money in the budget. It's a new fiscal year.
Thank you. Appreciate that.
Get it while
I
you
have a
can.
question.
Yes, ma'am.
Do you have any longitudinal data about the impact of going to these conferences and what it does for the youth who actually attend?
I don't. That would be something I would have to get with Miss Carson about. I do know typically the youth that she has attend these conferences, they have to be doing well in school because school has already started. They are typically on some sort of track, whether it's a 2-year college track to go to college or go to a 4-year college. And they have to have good behavior standing, not in any major trouble, in order to be able to go. But that's something I can get with Miss Carson about and see if she can get you some of the data. I know the youth that she took last year, one of them is going into her junior year of college at ECU in the social work program. And the other one is working full-time, and I believe he's in a 2-year program.
Wonderful.
What-
Good news stories.
Yes.
One year, they came, haven't been on this board a while, the youth came right after they went to this conference, and they gave a report of impressing things that they went, so that may be a good thing. We just don't want to send them for good times.
Yes, ma'am. I'll get with Miss Carson and see if any of the youth, at least maybe the one that's on our say-so board, can come and present
Correct.
some of the information and knowledge that they have learned as well.
That'd be great. Thank you.
And-
Thank
and-
you.
And when people come to the microphone, it might be good to put it down because I know your hair spoke very well.
So next time I'll pull it down a little bit lower. Yes, ma'am.
Thank you.
Thanks. Okay, now we have the interim director's report. Dr. Frazier?
Good afternoon.
Good afternoon.
There are a series of updates I have for the board. One is the agency vision report. I sent to you a one-pager on page 11 in your packages that has all of the details of this presentation. I am happy to report that TSS is now working with external hiring agencies to look at traveling social workers who can help us with our cases. We are working with Vanguard to give us some quality staff so that we can stop the bleeding and provide enough support to our current staffing ratios. We are also working with external partners like other counties to see what help they can provide to us of their working days. However, we learned very quickly that one county is charging us $23 and change per hour, which we cannot afford. So that is still under questions. Angela and I are working on the fine details. Hopefully, I will be able to identify some agencies or counties that will help us. in terms of loaning us their staff to come and do some hours to cover cases for us. We have a position that will exclusively work with each of our 10 counties. I will be meeting with each of the board members and the commissioners to see what trouble areas, zip codes, common issues, common challenges they have in their community. I will populate all of this for this new position. They are going to be the community social worker. They will not be in the office, they will be in the field. That person will be the first contact for everybody and anybody in terms of bringing DSS to the community. This individual will not only troubleshoot, they will be working with the school system, law enforcement, zip codes that we identify have specific challenges so that we can minimize some of the challenges that will come to the office, front load some of these services so that we can drop down the referrals. That position is already approved, and as soon as we get the state to approve the job description, then it will be advertised. So if you are listening to this, please apply when you get this application ready. Strategic plan is running. We are meeting hopefully in July, next couple of days, with the rest of our staff to give them a first-hand look of what was approved as the strategic plan 22-2027. This is going to be our benchmark upon which we can report to you every 6 months what has been done, what is the challenge, where we have scored, or where we need your help. So, we have good, in the midst of all of these problems, we have good stories. DSS across the board is meeting critical benchmarks. Adult services, as of last week, because the data I have was last week, I don't have the current data for today. We have 201 adults in our collective services. That is a lot for a division that has 10 cities with an aging population that is increasing. That is a lot. And I want to take my hat up to the Adult Services Department. Child welfare. We had, as of Friday, because Saturday we had 3 more added, we had 199 kids in foster care. 13 were adopted last year, 12 were unified with relatives, 47 were out of custody within 2 years. Huge success. Those are the stories that we should be telling people. DSS is working as partners to help you to be sustainable in your community, in your families. Economic services, well, you had the last 3 months, they have met the benchmarks. I must hasten to say they scored huge again this time. In one area, they scored 100%, the other, they scored 95%. Cumulative is 94%. Huge. Family support services, they passed the reader audit by the state. The reader audit is the most extensive audit that you can get as a DSS agent. Thank you, guys. Administration. Thanks to the hard work of all of the admin, we completed our budget. The budget was approved. We have done the reclassification of 4 positions that has been sent to the state. we have created a new division called continuous quality improvement. This is not a division that will police. It is just a division that will help us to increase our practices, to increase our quality, so that we can police ourselves rather than allow an external body to tell us what we are doing wrong. We have worked the 4-day work week. It is now a huge success. As of this afternoon, 4 other counties are referencing our brain, taking our model to see how it can work. I am not the expert on the 4-day work week. My staff love it. We have seen the numbers that has been coming from 1,500 a week to 1,700 second week to 1,800 third week, and this Friday we are already at 2,000 if we are not going to meet that 2,000 or surpass it. That is huge. Staff are now looking at this incentive and putting in their 100%. I am working with other divisions. Cynthia and I will likely work on this to see how we can bring this model in a variation of some sort into the adult services. And hopefully also tweak that to see how that will work for child welfare. The agency is moving. The health of the agency is strong. There are no way to say we don't have challenges. We do. But we are resilient. Every day, my staff are working to make sure the people of Pitt County have a safe environment. Children are safe. I thank you guys. The legal department is also making critical benchmarks and timelines, even though the cases are exponentially increasing. But we are hopeful that with all of the hard work, we can make these children safe, provide a safe environment for them to be able to unify safely. We have worked with a consultant that is currently working with us to see where are the gaps in our services. What are the areas we can, make improvements? And how are those improvements going to affect the outcomes? These consultants will be working with us for the next 90 days. Hopefully, when I will report at the outcome, we shall see what will be the benefit of this monies we spent. I will meet with the elected vice, the chair and the vice, and the former chair to give them a full update of the agency report so that whatever Mr. Cox knew, you will know firsthand. If I will stop so far, if you have any questions, I will answer those before I go to the agency personnel.
Yes, Dr. Fraser, I do have a question.
Yes, ma'am.
Regarding the 4-day work week pilot, could you clarify that is with the Economic Support Services Unit, is that correct?
2 units, the Economic Support Service Unit and the Family Support Unit.
Okay, and you're looking to see how it might work in adult services and
Correct.
children's services?
Yes, Dr. Bunch.
Okay, and you said it was a success, so I may have missed it, but how are you defining success other than the fact that the employees like it?
Numbers.
Okay,
Numbers don't lie. Our benchmark before the program was 1,500. Currently, we are at 1,800. As of yesterday, we are looking at 2,000 units.
I don't understand those numbers.
Were cases that were processed.
Cases that have been processed.
Correct.
Okay.
Okay, thank you.
There you go.
like
Now
that.
you're speaking English.
Yes.
Okay. Thank you.
You're welcome, Dr. Bond.
Okay. I
That's,
appreciate that.
those
really
are
good.
great improvements, aren't they?
Yeah.
Yeah.
And Dr. Frazier, if we could move up a little bit regarding the community social worker.
Yes, ma'am.
You have talked about this for quite a few months, and I guess I'm trying to figure out how that might work with that person not being housed here, but will work with 10 cities in the community. Will they have a temporary space somewhere, or is all that being worked out?
It's been worked out. They will have what I call a docking station. They will have a laptop, they will have a cell phone. If they want to meet with the director, they will come in, use their docking station, do their report, print it electronically, send that report, or update the director at any given time electronically. But their work will be in the community. Why am I looking at this differently? Since I have been here, July 6 was my second year, I have seen a lot of communities don't understand what DSS does. They don't even know how we operate. Everybody thinks DSS can solve any problem. And we want to see how we can front load this knowledge base into the community, how we can refer those. I am currently working with the Department of Health and ECU through Partnership for Health. Ms. Nelson is part of that group. So we are now collaborating. The MOAs and MOUs are being written so that we can collaborate and open what is called a one-stop center. This center will be there, so when you come in with maybe headache, you will have to see your dentist, example. So everybody will be there at the same time with areas of services that you can get in one location.
I would be very excited to hear how the details work out with this. So looking forward to future reports.
Absolutely, Dr. Bond.
I want to know, what have you established for this? Because I know that the census tracts are important for social service numbers, and planning can give you those tracts for Pitt County. Have you consulted with the director of planning?
Yes,
And you have those census tracts?
correct.
And you have established a place for those census tracts to receive a docking station for that social worker?
The docking station will be here, but they will have their laptops on them to work in each of the 10 cities. So
they'll
they
be
are
working
going
in
to,
That's something
they
that I
have a
missed.
mobile office. So maybe we'll put it that way, that would be easier. There will be a mobile office. They will have their laptops that will be manned and with a wireless and or MiFi.
What do you mean by mobile office? Are they in
Their
a vehicle on wheel or?
Okay. Mobile means they are not stationary in a location. They can be in Winterville tomorrow. The next day they can be in Eden. The next day they can be in anywhere.
So where will they light when they do that?
That's
So they will
that's
be
what
in
I'm
their-
trying to get to.
So let's say each of these municipalities have council offices. Winterville is already collaborating with us through one of their council members. So we already have an office in Winterville that has been established. Eden, we are working with as deputy acting mayor there. So these are being worked out. I was just giving you that this is coming, and Dr. Bond clearly said, you guys are interested to know the fine details. Once they are worked out, I will bring them up to the board.
Because I really like this idea, because being in an area with a large space of rural people, like 233 square miles, it will be ideal. It will help people receiving who are not, I don't want to say disadvantaged, who are not resourceful
Okay.
into getting services, it would save on their budget to not to have to travel, let's see, Pactolus is about 28 miles, not have to travel long distance, coming and going, which would be somewhere like 56 miles maybe, or to get services that they can have. So I'm very interested in knowing the docking station, so it would really cut down on me a great deal. I'm serious about that.
Commissioner,
because-
that is the intent of this position. I have said earlier, I'll work with the board, I'll work with the commissioners. We are going to sit down with you you are going to give us your troubled areas. You are going to give us your individual community challenges. Those, we already have the data for the population in each of the cities. We know what is growing, what is dropping, and which population age group is coming. So we have that data, but what we don't have is individual community problems. So that is where I will sit down with each of you, including this person who is going to be running this position, to see what is it that your community needs and how can we get into it. Then you will know when they are coming in your community, where they will be, or where you want them to be.
You don't have the person yet, huh?
No, we do not.
Okay. I certainly would like to help
Oh,
give you
absolutely.
some information into that, because
Absolutely.
that would save me a great deal.
I have a question.
Yes,
So
Ms.
will you be, with regard to the problems that y'all already know, so you have a database of all of Pitt County and all your cases, whether they're adult or child or whatever, can you pen map them? Can you get the planning department to map them for you? Then that way you, if you go to Stokes, you say you have this many situations actively going on over here, and then over here you might have, so you could sort of go where the kind of the collective problems are geographically first, maybe prioritize, figure out a way, an algorithm to prioritize, because it's one person. But I think that would be very helpful
Yes.
to know, and I know the planning department has the software,
GIS.
that they have the ArcGIS to be able to map, and you could have it in such a way that you would know, like you'd have a key, so you would know what they're there for. So I think that, I don't know if that's already your plan.
It's already done. Dr.
Okay.
Matthews from
Great.
ECU has already done what I call community mapping with spot and color coded. So that has already been done. What we need would
I'd like
be
to see
to
it.
understand each of these communities ourselves. Sometimes the data will be what was reported, but what is actually on the ground may be different. How much do I need to go into Stokes or to Aden or to Griffin to see if this number of people are actually needing food stamp? That will not be reported, except if I speak to the people and actually see their indices that they are reporting.
So have they also mapped the resources in the community around where those geographic areas are?
Well, technically James Rhodes did, but what he did was only for shopping centers, for hospitals, for schools, not for other aid things. That's development and it's limited.
Yeah,
But that will give us what I call a benchmark moving forward.
right.
So right now, if I want to know that, all I got to pick up the phone and Mr. Rose can shoot me a depiction thereof.
Correct.
Because I do know that the social service concerns, I'm looking for good words, that crop up in the community are referred, I do refer them to the planning department quite frequently. And that's, I like to see some data around that. And that's what, now I know I can just ask him for it
Yes,
and he
ma'am.
has it. Because housing is a problem and people always going about good housing and not just a place for shelter, but for housing and good drinking water. Those are issues and those are social service issues of my colleagues here on the board that has been of concern in my area, especially times like this. So I think I would like to recommend that each of us receive those as social service leaders for the statistics, so you can know. And don't give the GIS, give us the community location. There are 10 municipalities in Greenville, and there are some townships that you need to utilize, especially in the rural area, and we would know where generally the people are. So there are, I know, about 5 or 6 townships in my area, but only 1 municipality. So that's why I'm suggesting that the township be utilized. It may not be something that frequently known now by newcomers to Pitt County, but that may be something that newcomers could then identify with as to where it is. Because if I say Belvoir, then the people who live there will know, and other people in other areas would know too. That's what I'm trying to say.
Okay.
And that would be a good thing. I thank you so much for that.
Yeah, I just want to make a quick clarification. DSS, we don't do housing.
Huh?
We don't do housing.
No, I'm not saying do housing. But,
Okay, so I can refer you, I can work with community partners to see how we can refer you for housing. I'm working currently on one, and hopefully that will be reported to the board in the near future.
But see, as I also serve on a board of another board who does do housing. For instance, Green Lamp. And Green Lamp has a large variety beyond those services that are here. And programs, interacting programs. I'm not too much about wanting this agency to do that agency, but I'm looking forward to a family being able to get the services they need for the family to receive a better quality of life. That's what my interest is.
Okay.
I'm very strong about that. And if it's Pitt County or any county, if they have an agency over here, I don't mind doing that, but I just want to know so that we can assist that family, because that's the key to cut down on a lot of things, crime and bad health and everything else.
Okay. Noted,
Thank you,
Commissioner.
thank you. I look forward to you getting this person in place so I can certainly have the phone number.
Yes, ma'am. I hear you. I will now report on the status of the agency personnel. We are making progress. From 51, today we have 44 vacancies. Huge movement. Thank you, thank you, thank you. Tell your team, tell your supervisors, the board is very appreciative of the moves. And we have 5 positions that are frozen. 9 are interviewing. 10 are in advertisement. 3 are background check. 7 screening, and we reclassified 4. So this is a very good report, and hopefully next month we can say and bring those numbers down, hopefully.
So what's the remaining vacancies?
44,
44.
yes, ma'am.
And it was 55 prior
51,
to?
51,
51.
yes.
Let's keep on cutting them down.
I already gave a report on the Medicaid processing. They made 100%. The average is 94 in one area and 100% in the other area. So I just want to
my
update the
God.
board on the
you do
Medicaid
this?
expansion. There is currently a debate going on with Medicaid expansion. I want to prepare the board for the impact of this expansion on our current enrollees, current clients for Medicaid. We currently have 53,100 clients on Medicaid. With the expansion, we are likely to increase that to between 13,000 and 16,000 more clients. That will be huge. The last economic impact of that on the county, I am not an economist, but they are saying between 8 and 20 million. And to me, what is most important will be the number of people who are going to be able to access health care, like prenatal care, dental care. Those are areas that concerns DSS. At least we are able to get people who are currently not on the Medicaid, but we qualify under the expansion. So we are currently waiting for those to kick off and see how the impact will come. If there are going to be any structural changes in the programs, I will let you know.
I don't want to sound harsh, but my problem is that on page 12, I really could not read any of the fonts.
Okay.
So I like very much, and I must say that, as with, my doctor has asked me, told me not to do surgery on my cataracts because they're not that bad yet. So I have to take his medical advice since I don't have a lot of medical sense. So I would like your page 12, I like the thoroughness that it appears to be, but this is one page that I really hone in on. So I like very much for the font to be a bit bigger. I don't have 20/20, and my eyeglasses are not helpful. And what those things we do in meetings that we read it, the zooming. My eyes are zoomed to pieces. So help me out a little bit, please.
Yes, Commissioner.
I want you to know that I like this report, and this is one, but it's usually a little bit, yours is always a little lesser font. I want a better font. Thank you.
I appreciate that.
Thank you.
Noted.
I don't know about the rest of these guys
No,
out here, but I'm talking about my weaknesses.
You find, Commissioner,
Okay.
if you cannot read it, you can read it.
Okay,
I will make sure it's readable. Thank you. Any questions?
Dr. Frazier, in terms of discussion within your state network, in terms of Medicaid expansion, are they also talking about additional support if that happens in terms of things? I'm sure that needs to be part of the calculation.
We don't know yet.
But there is
Just-
discussion?
The discussions are still going on. Tomorrow I have a call with the state on this expansion. I may bring that up. But as of last week, we don't know if there is a staffing component
I see.
to the discussion yet.
Because it's
And-
not happened yet.
No, it has not.
Right.
So it's still being debated by politicians. And once it is now a law, then maybe DHHS can look at it and see what component will be for administrative or what component will be for operations.
Okay.
Because that was one of them that I had been exposed to and I couldn't see it at all. Thank you, Jim.
Anything else? Any other questions?
I think I bring mine up when they come up.
Thank you.
Thank you, Ms. Perkins. All right,
Thank you, thank you.
so we're not doing the closed session. Okay.
Where are we now?
So we're at the point for board member comments. Does anyone have any comments today?
I do.
You do?
Yes. I'd like to thank my colleague, Jim Cox, for his service to the DSS board. He served 2 terms, and most of that time, he was chair of the board. And so, you have worked very hard. You've been very diligent, been very supportive of the director, the former director, the interim director, and I just like to say, job well done. Clap, 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 clap. Clap.
doing a lot of clapping today.
Yes,
Very well said, Ms. Bunch.
yes.
Thank you, Dr. Bunch.
Yes, and I would like to congratulate our new board officers. And I'm sure you will be just as effective as Mr. Cox. And so all I can say is, may the force be with you.
So that means I have to get a telephone number of the chair. I have to get a telephone number for the chair.
Speed dial.
Thank you so very much. But I think Ms. Bunch has covered my comments. And I like to say to all of social service employees that we're pleased with the services that you provide. And during the department head, you know, it's good to be on this board, and there's no nag, and complaint, and you have a lot of different kinds of tasks that you face, and you handle them with utmost. That says a lot for you as a person in your position of the community moving forward, because y'all got some complaints? See?
We're
There you
blessed.
go, right there. There's 5 of us. So I'd like to commend the staff, and I don't usually do that, but I think it's sometimes that it doesn't hurt for not only us to commend each other for doing what's good, but the staff is to also be commended, because we are only as great as you are in your work. And that's my comment.
Well
Thank you so much.
Thank you.
Thank you. Anyone else?
Well, I'll say, hey, you guys do a lot, and I really don't think the community totally knows a lot about everything you guys do, so I simply want to say thank you.
Yes.
I really do. And to Jim, thanks for your guidance and leadership, but mostly thanks for being a friend.
Thank you.
Oh, that's great.
So.
Madam Chair?
I'd like to make a closing comment if I could.
Okay.
Thank you. Yeah, so certainly it's been my pleasure these last 6 years. It really has. And it's been my honor to serve on this board. It's been my pleasure to work with my fellow board members in terms of things, and I think we've worked well together, and I think that we have formed friendships through this. So I wish everybody well. And certainly, I really appreciate the work that is done within this department, and thank everybody that contributes to that.
It sounds like you're leaving Pitt. You're not leaving Pitt County. You are not leaving Pitt County, are you?
Mary Perkins, you have my phone number, and you use it. And I want to thank Dr. Frazier in terms of
Yes.
the report today and
Absolutely.
everything moving forward with what's happening here at Social Services. Thank you.
Madam Chair?
Well, I'll have to say that this is going to be a real honor and privilege. I hope y'all are patient with me as I try to learn. I learned quite a bit as the vice chair. I hope to learn more, but this work is definitely near to dear in my heart. We serve the least of these, and that's what I've always wanted to do in my profession. So this is great, and I'm looking forward to getting to know everybody a lot better.
So if I'm in order, Madam Chair, I'd like to move that we adjourn.
Second? Is there a second?
I'll second that for the last time.
All in favor?
We get up together.